it's National Lung Cancer Awareness Month, and new guidelines have been released urging people to get screened. When it comes to cancer, it seems you hear a lot about breast and colon cancer, but not necessarily lung cancer, which is actually one of the most deadly among women and men.
Yeah, so why is that? There seems to be a stigma around lung cancer disease, which does not have those telltale symptoms. It's a G thing.
G Thing, brought to you by Northwell, who believes when we raise health, we raise everyone. Northwell, raise health.
A life-changing diagnosis caught Marianne Casagrande by surprise years ago.
Did you notice anything wrong before the diagnosis?
Yeah, actually, I had a pain in my rib. I just assumed I strained something at work.
After a doctor took an x-ray on what she thought was a strain or a broken bone, turned out to be stage 4 cancer. Marianne was in shock.
I'm not sure if he was more shocked or I was more shocked when it came back and there was a mass there that should not have been there. It led a pretty full life, pretty healthy, so I thought.
Lung cancer is often thought of as a smoker's disease, but that's far from the reality. Dr. David Hill, the director of research at Waterbury Pulmonary Associates, says there are so many factors that can cause lung cancer.
Secondhand smoke exposure is a risk. Radon is the #2 cause of lung cancer in the United States. There are occupational risks in certain industries, particularly with chemicals or fumes and radiation. And there are risks from air pollution.
If the disease runs in your family, you may also be at risk. This was the case for Marianne. Her father also had lung cancer.
Well, lung cancer, Dr. Hill, it seems to me, I'm reading that it's a leading cause of, it's one of the leading cancer killers, right? But it seems to not get that kind of surge in the press. Am I right?
You're exactly correct. It's not a leading cause. It is the leading cause of cancer mortality in both men and women. It doesn't get the attention it deserves because there's a stigma with lung cancer. For years, we've talked about how bad smoking is, and lung cancer is associated with smoking, and there's a tendency to blame the victim.
And while over 500,000 Americans fall victim to lung cancer, it's a curable disease, but it has to be caught early. That's why screening is so important.
What are potential signs that you're having a problem?
So it's challenging with lung cancer because the symptoms can be very nonspecific. Chronic cough can be a sign of lung cancer. Pain in the chest can be a sign of lung cancer. Shortness of breath.
Marianne, who is not only an advocate for herself, but others, says people need to be aware they should ask their doctor for screening.
If you have lungs, you're susceptible to lung cancer. I can't stress how important it is.
How has your outlook on life changed, Marianne?
I want to inspire people. I want someone to look at me and say, because of you, I didn't give up. So I guess in sharing my story, that's my hope.
So the recommended age for lung cancer screening is 50 years old. However, you are encouraged to be your own health advocate as always and talk to your doctor about any risk factors you may have.
If you would like more information, head to the American Lung Association website at lung.org.
What a great story, Gene.
You know,
important to talk about.
Yeah, it really is, and it's the leading cause of mortality, and most people associated with the stigma of smoking.
Sure.
What really impressed me about her, and we have to get this point across, she has stage 4 cancer, but it's manageable. She's functioning, okay? And that's a big increase in science. So, Marianne, thank you a lot. We wish you a lot of good luck in terms of staying well, and the doctor, thank you as well.